In 2014, 250,000 Vermonters will access health care in a new way. Like fellow citizens across the U.S., individuals, families, and small businesses are faced with choosing health plans that best meet their needs and budgets. I'm Nathan O'Leary for Comcast Newsmakers in the historic chapel on the campus of Vermont College of Fine Arts in Montpelier. And Mark Larson, Commissioner of the Vermont Department of Health Access, joins Newsmakers. And welcome, Commissioner.
Thank you very much.
Let's start with, what is the new insurance marketplace?
So Vermont Health Connect is a new way for Vermonters to access health coverage, whether it's public or private, and it allows Vermonters to have a way of providing side-by-side comparisons of their health plan options so that they can pick a plan that's best for them and their budget. It allows them the opportunity to access financial help if they qualify to lower their premiums and out-of-pocket expenses, and it takes some of the guesswork out of trying to find coverage that works for you.
How's it been going, the whole setup?
We've really hit a milestone. This is a major step forward for Vermont and the U.S. in terms of making healthcare more affordable and more accessible to Vermonters. So we've certainly had some bumps along the way, but I think that we've made some tremendous progress in making sure that people have access to healthcare.
Let's talk about some specifics. How does this change things for Vermonters?
So for those Vermonters who get their insurance coverage through work, if they work for a small business, their employer would be able to access coverage through Vermont Health Connect. And one of the nice benefits is that employers would be able to offer their employees more choice than they have in the past. They'd be able to offer more plans, and employees would be able to pick a plan that works best for them. For people who don't get access to insurance through work, they're going to be able to access more options than they have in the past, and they'll be able to, again, access financial help. We know that for Vermonters who don't get insurance at work, that's been some of the most expensive insurance for them to find. And I think many Vermonters will find their coverage much more affordable through Vermont Health Connect.
Now, how is Vermont different from other states? Because, Vermont, to begin with, it's a much smaller state.
We are a smaller state. We also have fewer Vermonters who are uninsured than many other states. And so what Vermonters will experience is that it'll be easier to find plans, to compare them, and to access them through either our website at www.vermonthealthconnect, through our call center, or through navigators or brokers who could sit down with somebody in person. So hopefully there'll be more resources available in Vermont than people have had in the past.
And when you see there's a national dialogue about this whole thing, Vermont doesn't really fit into that national situation. Vermont is its own kind of thing. I think that needs to be emphasized.
Yeah, we are unique. We have been a healthcare leader for a long time, and we will be into the future as well. The implementation of the Affordable Care Act is an important step in that process, and the implementation of Vermont Health Connect is an important step. Ultimately, we're looking to make sure that every Vermonter has coverage regardless of their age, their income, where they work, or their employment status. And that's the work that we're excited about getting to after we successfully implement Vermont Health Connect.
And I know there's a timetable that people really need to be aware of.
Yeah, so October 1st was a big day. That was the start of the open enrollment period where people could begin comparing the plans, being able to set up their account, and begin their selection process. For those who need coverage by January, they want to be able to compare their plans in October and November, but then by early December, they want to complete their selection and pay their premium so that they'll be covered in January. For those who don't need coverage in January, the open enrollment period goes all the way through March, and people can continue to shop and compare and make their selection through that time.
Okay, so get to that website. Okay,
Absolutely.
We're going to put that information up for people too. Thank you for joining us for Comcast Newsmakers, Commissioner.
Thank you for having me.
And thank you for joining us for Comcast Newsmakers. I'm Nathan O'Leary.